last 4 months have been busy for members, leaders and staff of the Ontario Nurses Association, with the number of registered nurses being cut across the province, plus with the added threats of a Tim Hudak-led PC government, our More Nurses campaign kicked into high gear. More Nurses ads, buttons and materials have been distributed with an overwhelming and positive response. More than 800 ONA members have attended political action workshops. ONA staff, too, have attended sessions and canvassed the public about the future of healthcare in Ontario. ONA has incorporated our More Nurses message at virtually every event across our province so that the public can make an informed choice when they go to the polls on June 12th. At the National Nursing Student Games in Toronto on March 22nd, future RNs enthusiastically took up ONA's More Nurses campaign. The next day, Ontario nursing students discussed issues with ONA reps at the information table. The March Provincial Coordinators meeting took place at our new home, the Weston Harbour Castle in downtown Toronto. ONA President Linda Haslam-Stroud warned delegates about the 3 biggest challenges facing the nursing profession in Ontario today: a lack of frontline nurses, the struggle for a fair hospital-central collective agreement, and the serious threats to healthcare and labour rights posed by the Tim Hudak-led Conservatives.
Don't you think enough is enough? Don't you think that we have balanced the budgets of these hospital employers specifically for far too long? Don't you think it's time for us to say enough is enough?
Nick Alves, outgoing Ontario Director, and Catherine Davey, incoming Ontario Director of the Canadian Nursing Students Association, brought greetings on behalf of 14,000 nursing students.
We always appreciate the support we receive from ONA. We feel it today, we feel it all throughout the year. I can email any of these people right here and feel their support with an email back. And I know that all our CNSA members feel the same way. Thank you, ONA, for fighting for more nurses. We see the heavy workloads in clinical every day.
Virginia Green, nurse practitioner and bargaining unit president at Grand River Community Health Centre, remarked on achieving the unit's first collective agreement after a 100% vote in favour of job action. Marie Kelly, Director of Labour Relations Contract Administration, delivered a positive report noting that ONA is winning the majority of arbitration cases. ONA members celebrated the many contributions of Valerie MacDonald. Now retiring as Manager of Contract Administration and Bargaining Process, Valerie helped form the union in 1973, joined the staff in 1995, and has been a key negotiator. Members awarded her an honorary membership. Local Aid Coordinator Susan Summerdike and Windsor Regional Hospital Chief Nursing Executive Karen McCullough were excited to present their new electronic professional responsibility complaint process, which is already showing improvements in patient and nurse satisfaction at the facility. One highlight at the March PCM was a panel on the successful independent assessment committee process at Rouge Valley Health System. Appalling conditions in the post-acute care unit caused registered nurses, with the help of ONA staff, to seek the intervention of an independent assessment committee. The IAC ultimately validated RN's concerns and led to management changes. ONA members and their supporters from other unions marched on Queen's Park to demand the hiring of more nurses across the province.
Let me tell you, our patients are looking in our eyes. They know we save lives, and they know that we are credible, that we are their advocates, and we know that they want us on the front lines to care for them each and every day.
ONA was a participant in We're All Invested, an information session on pensions on March 17th in Toronto, organized by the Healthcare of Ontario Pension Plan.
There's a stunning consensus. 86% of Ontarians say that there is a retirement income crisis in Canada, and those numbers have been steady now for 3 or 4 years. People think that employers should be providing pensions to their employees, should have a pension plan in place for their employees to access. Second of all, people clearly see a role for government here. They clearly see a role for government policy to set rules, set regulations, and encourage the private sector to be offering retirement income security.
We don't believe that the public should be the innocent victim in the settling of our disputes, so we are asking the government to give us an arbitration process. We are actually being discriminated against because our hospital nurses, our homes for the aged nurses, our nursing home nurses, nurses employed directly by the province have arbitration. These nurses do not, and they're forced then, in order to resolve a dispute, to take the confrontation aspect.
On April 30th, dozens of ONA members attended the annual Occupational Health and Safety Caucus. This year's theme was Driving Your Workplace Health and Safety Agenda. In a lively panel discussion, registered nurses Elizabeth Hart and Judy Evans described how they first became involved in health and safety and how they were able to make positive changes in their workplaces.
1,000 people died in 2013 because of work. And the Canadian Labour Congress research shows that over the last 15 years, our numbers are getting worse, even while in other OECD countries things are getting better.
On May 2nd, ONA held a general meeting for local leaders to present and discuss the arbitrated Hospital Central Collective Agreement. After hard-fought bargaining, ONA's Hospital Central negotiating team was disappointed with the arbitration award. Despite nurses having endured a 2-year wage freeze, the new 2-year award provides just a 1.4% wage increase in each year.
It's been a difficult round. I have spent many months, as your team and your staff have spent many months listening to the rhetoric regarding concessions, regarding that we are already rich enough, didn't you know? I am sick of listening to the words regarding rollbacks. If I've heard it once, I've heard it 100 times. And that is the modus operandi of every employer in this province, whether it's in healthcare or whether it's in the public service. It is rollbacks, private sector as well. And I am very, very proud to stand here today and say to you that there is not one rollback or one concession in this contract. And thank you to your team for that.
The arbitration decision did hold one piece of good news for newly graduated registered nurses. The arbitrator rejected all of the Ontario Hospital Association's proposals, which had included a 3% cut to the start rate for new RN graduates. ONA delegates travelled to Montreal for the convention of the Canadian Labour Congress, May 5th to 9th. ONA members joined up with a delegation of the Canadian Federation of Nurses Unions. Convention attendees witnessed the election of a new CLC president, Hassan Yusuf. ONA, CFNU, and CLC delegates marched on Montreal streets against the austerity agenda.
In Nova Scotia, we have a saying, well-behaved women don't make history, and well-behaved unions don't make history.
Inspired by our provincial campaign, this year's Nursing Week theme was More Nurses, Better Care. Events were held across the province to celebrate the many achievements nurses make each and every day in healthcare. Working with many groups across the province, the Ontario Health Coalition is touring Ontario with a giant 10-foot-tall rocking chair. The OHC hopes the next Ontario government will set a minimum care staffing standard of 4 hours of hands-on care per day per resident, and improve access to care and reduce placement wait times. The coalition aims to collect 20,000 signatures on postcards, symbolizing the 20,000 people waiting for long-term care placements. Nurses are waiting to see what the next 4 years in Ontario politics hold for healthcare. Whatever the election result on June 12th, our More Nurses campaign will be as necessary as ever. ONA and its members will rise to the challenge.